Well, the state of nursing is in the spotlight for National Nursing Week. A new CUPE and SEIU healthcare poll finds that 60% of nurses are ready to quit, a figure that jumped significantly from 34% in just 2020. This according to the Registered Practical Nurses Association of Ontario. So for more on this, we're joined live by Dianne Martin, the CEO of the Registered Practical Nurses Association of Ontario. Dianne, these are disturbing numbers here. Why are nurses either leaving or strongly considering leaving?
Well, I would say that the last few years have taken a toll. Nurses who traditionally are educated to provide a certain level of care have been heartbroken by arriving at work each day and having to decide what parts of the care I'm supposed to provide am I going to actually provide today. And the nurse crying in the car at the end of a shift has kind of become the symbol of the heartbreak that they're experiencing. And there's just so long that a nurse can engage in that sort of a situation without anyone actually making an offer to resolve some of the issues.
Dianne, where do nurses go if they leave the profession? I mean, if you're looking for work in Ontario, you're effectively working under the same contract. So where do they go? Do they leave nursing entirely?
Yeah, so that's a really good question. And actually, the answer is no. If you were just to look at how many nurses there are in the province, you'd see that the numbers are not encouraging. They're not increasing like we need them to increase to care for our growing elderly population. But they're not decreasing at a rate that actually represents them leaving the bedside. Nurses are going from full-time to part-time to try and control their work schedules better. Nurses are moving to non-bedside jobs, leadership jobs, those sorts of things, but all roles that impact the amount of care available to patients.
Yeah, and that leads me to my next question is, with what's going on here, what is that going to mean for patients now and going forward then?
Well, 7 out of 10 of our nurses tell us that they believe that healthcare has been incredibly compromised due to the nursing shortages that have happened. So when you ask them, do you personally, have you seen a patient negatively impacted by a lack of care? They say yes. And I think that they are really clear on what they need to return to the bedside. And that's what we have to implement.
We've been talking about this, obviously, throughout the pandemic, the situation and stresses on frontline healthcare workers, obviously including nurses who, everyone agrees are really the backbone of our healthcare system. We've also heard the provincial government, recently talking about, getting more training, paying for nursing tuitions, these sorts of things. Is the provincial government then doing enough to maintain and, bring on more nurses? Because we hear from the one side that they seem to be doing that. What are you seeing and hearing from your side of the things?
We need two things in nursing. One is to recruit more nurses, and that's what the government's talking about and what they've been working on. But the other thing we need is retention. There's no point bringing in new nurses without keeping the ones we already have. And our nurses tell us that they were really impacted, particularly registered practical nurses, on the Bill 124 that limited their pay raises to 1% per year. When practical nurses were already far behind where they should be, and with a role closer to registered nurses, but yet making quite a bit closer to PSWs, in some cases less than a PSW. The other thing they tell us is that they need nurse-to-patient ratios, where they can arrive at work each day knowing exactly how many patients they'll be required to take care of that day, so that they can be reassured that they will be able to provide the care that they've been educated to provide.
Okay, really appreciate the time this afternoon. That's Dianne Martin, CEO of the Registered Practical Nurses Association of Ontario. Have a good day.
Thank you.